Today we're going to ask Dr. Vijay about breast augmentations. Dr. Vijay, when someone comes in for a consult for breast augmentation, what do you look for, or who's a candidate for those?
So the first thing I like to find out is what they're getting the breast augmentation for. For example, are they looking for more upper pole fullness? How much of an increase in size they're looking for? So once I get an idea of the results that they have in mind, then I proceed with my discussion. Important discussion is whether or not they're having more children or planning to have more children, and if they're planning on breastfeeding said children. The next thing I ask them is what their lifestyle involves. For example, are they fit for fitness sake, or are they competitively fit? For example, competing in Miss Corpus Christi, since that's where we live, or in CrossFit. It has bearing on what type of implant I'd recommend, the position of the implant, whether it be underneath the muscle or above the muscle, and also, of course, saline versus saline.
And where's the most common position for the implant that you usually place your implant?
My standard recommendation is underneath the pectoral major muscle. So reasons for that, that position has been shown to have a lower risk of infection and capsular contracture or scar tissue formation in the future. So it tends to give our patients a more amount of time with the same implant and excellent results. It doesn't cause increased pain for the patient. The time of recovery is also not lengthened by putting it under the muscle. The big downside of putting it under the muscle is something called animation deformity. And that's where my question is as to their fitness and their profession. That's where it comes into play, because if they're going to be bodybuilders and stand on stage and flex their pectoralis muscle, well, then they get a little animation deformity and you lose points for that. Those specific instances, I will go in front of the pectoralis major muscle, and of course I'll inform my patient that there is a slightly increased risk of developing a scar tissue. But to mitigate that, as I do with all my patients, I do see them once a year to make sure that there's nothing going on, no early scar tissue, because if you can catch most issues early, you can treat it and avoid additional surgery.
The big question I think we get asked is where the incision goes.
Well, there's three choices. One is underneath the breast, another one is at the inferior border of the areola or the pigmented skin around the nipple, and the third is the axilla. Of these three options, I prefer the incision underneath the breast because it's been shown to have the best long-term results, the lowest malposition issues, in other words, lowest issues with the implants being in the wrong position, and also a lower infection rate, especially than the intra-areolar incision, where quite often or sometimes you can go through the breast tissue when making that incision, and that does increase the risk of both infection and altered nipple sensation.
It's a process after they have their surgery. When can they go back to work? When can they go back to the gym?
So I tend to use a block whenever I put the implants in. So it's called a PEC2 block, and we put in a mixture of local anesthetic that diminishes the amount of pain our patients have, and it lasts for about 2 to 3 days. So this makes it a lot less painful, improves recovery, and so I recommend that my patients return to work in about a week, unless their work involves a lot of heavy lifting and manual labor, in which case I recommend they wait 2 weeks. Returning to the gym, usually in about 2 weeks after surgery.
Well, thank you, Dr. Vijay, for those wonderful answers.